Hey there, my name is Alicia, the PA here at Orlando Facial Plastics.
And my name is Maria, I'm the nurse practitioner here.
And welcome to our video for your pre- and post-op rhinoplasty care. The week leading up to your surgery, we ask that you do not take any ibuprofen, aspirin, any type of NSAID that will cause any increased bruising or bleeding afterwards. Also, the week leading up to your procedure, we will send all of your medications to your pharmacy so that you can pick them up, but please do not take them, they're for after surgery. There will be 5 medications that we send. One will be a pain medication that you'll take every 4 to 6 hours as needed. If your pain is mild, we ask that you take extra strength Tylenol instead. One medication will be an antibiotic. The other will be a steroid, which typically comes in a pack. So it will start with 6 pills on the first day and taper down from there. So it'll be 5 pills the next day, 4, 3, 2, and so on. The last 2 medications, one will be a saline spray and an ointment. Both of these will really help clean you out after surgery. The saline spray you'll squirt into your nose 2 to 3 times a day, and the ointment you'll put on a Q-tip and put inside your nose where the stitches are. We do ask if you work in close contact with patients or in certain facilities like healthcare or a hospital setting or a flight attendant, we do ask that you start the ointment 1 week prior to your surgery. That decreases any risk of infection or colonization of certain bacteria. Also, if you do know that you are at increased risk for nausea with certain medications like pain medications from your prior surgeries, we can also send medication for nausea if need be.
The morning of your procedure, we ask that you wear something comfortable as you will be changing into one of our patient gowns. We also ask that you do not wear any jewelry or bring any valuables with you, and please do not wear contact lenses. For surgery, you'll either receive a phone call from one of us here at Orlando Facial Plastics or a staff member at Maitland Surgery Center to give you your arrival time. The arrival time should be about 1 hour before your scheduled procedure. We will also ask you to not eat or drink anything after midnight the night before your procedure. In terms of recovery, we would like you to know a few things in order to have a successful recovery at home. The first thing we'd like you to know is we do not want you to do anything strenuous for the first week after surgery. No heavy lifting, no exercise for at least 2 weeks, no contact sports like volleyball or soccer for 6 weeks, and no sunglasses for 1 month after surgery. After surgery, we would like for you to start out eating something light, like toast, crackers, or soup. Nothing too greasy or heavy because we don't want you to have any nausea. We do want you to sleep elevated after surgery. We prefer that you use at least 1 or 2 extra pillows behind your head so you're not lying completely flat. This will help with swelling and inflammation after surgery. In addition to that, we will be providing you an ice pack to take home, which is going to look like this, and we're going to have you use this on your cheeks and on your forehead for the first couple of days after surgery while you're awake. When you wake up from your procedure, you will have a cast that sits over the bridge of your nose, and you will also have a nasal drip pad that sits underneath your nose to catch any drainage because you will have a little bit of a nosebleed for the first 24 hours. We will provide you with extra gauze and show you how to change that nasal dressing out the day of surgery. You will have the splint on the bridge of your nose for 1 week after surgery. You will come in to the office to have it removed. We do not want you to get the splint wet for that first week, so we ask that you please take a shower from the neck down. You are able to wash your hair and get the splint wet only the day of your splint removal, which we will schedule for you. Please make sure you have a responsible adult that can be there for you for the first 24 hours after surgery. We will call to check in on you that evening after your procedure, and Dr. Saigal will personally call you as well to check in. Thank you for trusting us here at Orlando Facial Plastics. We want you to know that we are available to answer any of your questions or concerns 24/7.